First, consider your goals in therapy. What are you hoping to gain? What are you noticing in your day-to-day? Symptoms, changes, life adjustments. These are really important. If you've worked with a therapist before, what worked for you and what didn't? Hello, this is Veronica, and I'm a therapist. Today I want to discuss, a really common question I get, which is therapy right for me? I hear so many different stories about therapy, and I think oftentimes I hear things like, I had mental health concerns, and I did a consultation with a therapist, and I didn't really feel like I was comfortable. How many times has that happened to you? And I think on top of that, sometimes people feel as though therapists aren't really hearing their concerns. Maybe you don't feel like they're empathizing with you and what you're going through. Maybe you feel like they're having trouble understanding some of your concerns and overall challenges. Or maybe you have a few sessions with a therapist and they say something that offends you or that you feel is hurtful. Additionally, some people have had therapists who don't really assist them in reaching their goals, which can make them feel as though they're not really making a lot of progress. In all fairness, though, this is also dependent on your desire to change. So are you putting in the effort? Are you being open, honest? Those are really key markers for success in therapy. Therapists are not really a one-size-fits-all, and I know that all of this can really make people feel pretty hopeless and as though therapy just might not be right for them. But really, you have to feel comfortable and connected to your therapist, and at times, general personality differences can stop that rapport from being built and can also make someone uncomfortable and hinder their exploration process. So shopping for a therapist is completely normal. And here are some tips for understanding what to look for in a therapist. So first and foremost, when thinking about what therapy is really about, many think that therapy is just a space to vent in which, many people believe that their family and friends are sufficient. Like, I don't really need a therapist. I have my best friend, I have my husband, I have my wife, I have my mom, dad, whoever. But that's not really the case. So therapy is a space where you can explore some of your deepest thoughts and experiences with a professional in a non-judgmental setting. Therapists are also clinically trained to guide you towards helpful connections and realizations that can really alter your perception in ways that your friends or family members can't. I really doubt that your mom or dad can walk you through inner child work or something to that effect, unless they're therapists, in which case that comes with its own problems. But therapists can focus also on psychoeducating clients on their disorders and symptoms to really grant clear understanding of their experience. And it kind of helps alleviate some of that feeling of, am I crazy? Am I just, insane? What's going on here? When you better understand what's actually happening with the pathology of the disorder you're experiencing. Therapists can also assist clients in processing difficult traumatic situations in a controlled environment that doesn't lead to any fear of information getting, told to someone else or any judgment, or even just like responses that are not emotionally attuned. Sometimes our just typical family members who are not clinically trained don't really respond in the best ways and might even judge or there is kind of a risk of them going to tell somebody. So that doesn't really happen in therapy. Therapy is also a place of unconditional positive regard. So this can help really facilitate this feeling of hope and education and understanding that individuals can truly take time to discover their own selves and embark on their healing journey in an environment that really facilitates that for them. So another question I get all the time is, what do I look for in a therapist? So first, consider your goals in therapy. What are you hoping to gain? What are you noticing in your day-to-day? Symptoms, changes, life adjustments. These are really important. If you've worked with a therapist before, what worked for you and what didn't? I think that's also extremely important. Past diagnosis, if you have any, searching for a therapist that might specialize in trauma, OCD, depression, or anxiety disorders is really important in finding someone with the right qualifications and the right knowledge tools. Additionally, something else that I hear a lot of clients kind of, seeking and you should consider for yourself is cultural background. Does this matter to you? Are you from a specific cultural background that you feel as though if someone was of that same background would understand you a little bit better, and kind of relate to you better? Is gender important to you? So those are something to consider. Another thing to consider is, kind of more practical and logistical, which is scheduling. Is your therapist, have a lot of availability? Does this therapist have some flexibility? What fits your lifestyle? Do you need evening sessions? I think those are all really important for the continuity of care when you consider, having consistent sessions, having consistent treatment. Scheduling is a really big one. Financial sustainability, another logistical thing, but is really important. This is really important because if you cannot afford the care that you need, therapy can really become a burden and impact your ability to heal. Also, if you have to stop treatments with a therapist due to financial reasons, this can be disheartening and impact your progress and really kind of just leave you discouraged. So if you're already in therapy but don't feel as though you're progressing, consider first the effort that you're putting in place in therapy. Do you feel as though you're taking the suggestions to heart? Are you really, really trying to be honest, vulnerable, and reach your goals? Just things to consider. Also, the overall relationship that you have with your therapist. According to the American Psychological Association, APA, a vast majority of good work can be hindered by a weak therapeutic alliance. So if you don't feel as though you're getting along with your therapist, or overall that you don't mesh with them, this is really, really important to ponder. Just to kind of give you guys a background of what I usually do to build rapport, I usually enjoy learning about their likes, dislikes, hobbies, and more about their work. This kind of assists me in understanding them on a deeper and less formal level that kind of eases and breaks some of the ice and grants some of that comfort that I'm referring to. I also enjoy sharing small bits about myself. This is called self-disclosure, and this is done very carefully, and only in situations where I believe that it can facilitate rapport and serve a purpose for the therapeutic alliance. Sometimes I enjoy relating to and often checking out some of my clients' favorite movies, shows, or even music to better comprehend their mindset and overall connect with them on their likes in that way. Where should I start? If you would like to use your insurance, first of all, contacting your insurance provider to obtain a list of covered mental health professionals can be a really great place to start. If you can't locate this, even informing your primary care physician that you need a therapy during your next appointment, checkup, whatever, can get you a referral list and can assist you in obtaining services through your insurance, and kind of just give you a platform to start calling individuals who are covered by your insurance and kind of just give you a place to begin. Psychology Today is also a really great resource. You can narrow down your services, specialties, locations, and even insurance. You can read about each therapist and learn about their backgrounds, experiences, and you can contact them and begin consultations, which also can help you get started. Another great resource is Path Mental Health, and all of these will be linked below. This can offer affordable mental health services as well. Pretty similar to Psychology Today, but it's really focused on affordable mental health services. Just in case you don't have insurance or, your insurance doesn't have mental health coverage, this can be a really good resource. So in summary, according to the CDC, the number of individuals seeking mental health treatment between 2019 and 2021 has increased significantly. This can be due to the pandemic, as well as just overall trends in individuals educating themselves on mental health and their symptoms and seeking help. No matter the reason, this is a true testament to the fact that you're not alone, and that many individuals are seeking professional help too. Although it can be nerve-wracking to really begin the work, therapists operate at your pace. So even if there's something that is really difficult and you're unsure that you'd like to tackle right off the bat, don't worry about it. Inform your therapist that you're not ready to discuss something, and they should respect your boundary. Therapists are here to guide you through your experiences and process deep hurts to better aid you in gaining tools for your self-healing journey. Although social supports are very important, who can heal you better than you? It is important to take time to learn about your thought processes and coping mechanisms and your own trauma from a different perspective to better comprehend how you can really show up for yourself. Let's get the journey started.